Imagine doing everything right for your blood pressure. Eating less salt, walking every day, taking your heart meds faithfully. And yet your numbers keep creeping up. Not because of stress, not because of age, but because of a pill you take without a second thought. Today, a cardiologist is warning you about 5 very common medications that can silently raise your blood pressure, and most people have no idea they're redoing it. Many patients walk into a cardiology clinic confused and frustrated. They say, "Doctor, I don't understand. I'm careful with my diet. I don't smoke. I check my blood pressure every day. Why is it still high?" And often, the answer isn't what they expect. It's not always the heart. It's not always the kidneys. Sometimes it's sitting right there in their medicine cabinet. Here is the uncomfortable truth. Some of the most commonly used pills in the world, pills people take for pain, allergies, colds, mood, or inflammation, can quietly push blood pressure higher over time. They don't cause an immediate spike that sends you to the emergency room. Instead, they work slowly, subtly, day after day, until your readings are consistently higher than they should be. And if you already have high blood pressure, heart disease, diabetes, or you're over 40, the effect can be even stronger. Let's start with one of the biggest and most overlooked offenders: common painkillers. Medications like ibuprofen, naproxen, and other non-steroidal anti-inflammatory drugs, often called NSAIDs, are taken by millions of people every day for back pain, knee pain, arthritis, headaches, and general aches. They're easy to buy, they seem harmless, and they work well for pain. But inside your body, they can interfere with how your kidneys regulate salt and water. When the kidneys hold on to more sodium and fluid, blood volume increases. And when blood volume increases, blood pressure rises. Cardiologists see this all the time. A patient with controlled blood pressure starts taking a painkiller daily for joint pain. A few weeks later, their numbers are suddenly higher. They assume it's stress or aging, but when the painkiller is stopped or reduced, the blood pressure improves. This effect is especially dangerous for people who already have hypertension, kidney disease, or heart failure. Even short-term use can raise blood pressure, but long-term daily use is where the real risk lies. The second group of pills that often surprises people are decongestants found in cold and flu medicines. If you've ever taken a pill for a stuffy nose and felt your heart race a little, that's not your imagination. Ingredients like pseudoephedrine and phenylephrine work by tightening blood vessels to reduce nasal swelling. The problem is, they don't just tighten blood vessels in your nose. They tighten blood vessels throughout your entire body. When blood vessels narrow, pressure inside them goes up, just like squeezing a hose makes water shoot out faster. For someone with normal blood pressure, this might cause only a small temporary increase. But for someone with high blood pressure or heart disease, it can cause a significant spike. Cardiologists often warn patients never to take cold and flu medicines without checking the label carefully. Many people unknowingly combine these decongestants with their regular medications, not realizing they are directly counteracting their blood pressure treatment. Now let us talk about a third category that flies under the radar: certain antidepressants and anxiety medications. Mental health treatment is incredibly important, and no one should ever stop these medications on their own. But it's also important to understand how some of them affect the cardiovascular system. Certain antidepressants, especially those that increase levels of norepinephrine, can stimulate the nervous system. This stimulation can cause blood vessels to constrict and the heart to beat faster, both of which can raise blood pressure over time. Cardiologists often work closely with psychiatrists for this reason. It's not that these medications are bad or unnecessary. It's that blood pressure needs to be monitored carefully when they are used, especially in people with a history of hypertension. Sometimes a simple adjustment in dose or switching to a different medication can make a big difference. Another medication group that causes hidden trouble is steroids, such as prednisone. These drugs are powerful and life-saving for many conditions, including asthma, autoimmune diseases, severe allergies, and inflammatory disorders. But steroids also cause the body to retain salt and water, similar to NSAIDs, and they can alter how blood vessels respond to hormones. The result is often increased blood pressure, especially with higher doses or long-term use. Many patients notice swelling in their face or ankles while on steroids, but they don't always connect it to blood pressure changes. Cardiologists often see blood pressure rise steadily during steroid treatment and gradually improve once the medication is reduced or stopped. Again, this doesn't mean steroids should never be used. It means they should be used carefully, with awareness and monitoring. There's one more category that surprises almost everyone, and it's one of the most common medications taken worldwide. But before we get to that, it's important to understand something crucial. Never stop or change a medication on your own after hearing information like this. The goal is awareness, not fear. The real danger comes from not knowing and not monitoring. By understanding which pills can quietly raise your blood pressure, you give yourself power. Power to ask better questions. Power to read labels more carefully. Power to work with your doctor instead of feeling confused or helpless when your numbers don't make sense. In the next part, we'll reveal the fifth medication that cardiologists warn about the most and why it is especially risky for older adults, and I'll also talk about safer alternatives and what you can do if you're already taking one of these pills. The fifth and often most surprising culprit is certain hormonal medications, especially birth control pills and hormone replacement therapies. Many people don't realize that these medications can subtly increase blood pressure, particularly in women over 35, smokers, or those with a family history of hypertension. Estrogen and progesterone influence how your body handles salt and fluid, and in some people, this can lead to a measurable rise in blood pressure over time. Cardiologists often check blood pressure before starting these therapies and continue monitoring regularly, because early detection is key to preventing complications. So, now that we've identified the 5 main categories in SAIDs, decongestants, certain antidepressants, steroids, and hormonal medications, what can you do if you take one or more of them? First, never stop a prescribed medication without consulting your doctor. The risks of abruptly stopping certain medications can be far greater than the potential increase in blood pressure. Instead, schedule a discussion with your physician. Bring a list of everything you take, including over-the-counter pills, supplements, and even herbal remedies. Many natural supplements can also raise blood pressure, and your doctor needs the full picture. Second, monitor your blood pressure at home. This is especially important if you're restarting a new medication or taking one of the 5 categories we discussed. Modern blood pressure cuffs are affordable and easy to use, and keeping a log helps your doctor make informed decisions. You don't need to check obsessively, but a few readings at the same time each day over a week can reveal trends that a single reading at a doctor's office might miss. Third, look for safer alternatives. For pain relief, acetaminophen is often a safer choice than NSAIDs if your doctor approves. For congestion, saline sprays, humidifiers, or nasal rinses can reduce reliance on decongestant pills. Some antidepressants have a lower impact on blood pressure, and sometimes switching medications or adjusting the dose under professional supervision can help. Hormonal therapies may have alternatives or adjustments that reduce cardiovascular risk. And in all cases, lifestyle factors like reducing salt intake, maintaining a healthy weight, staying active, and managing stress amplify the benefits of medication management. Finally, awareness is your strongest ally. Most people assume that a pill prescribed by a doctor or bought over the counter is harmless. In reality, nearly all medications have side effects, and blood pressure elevation is one of the silent, underestimated ones. By knowing the risks, tracking your numbers, and having open conversations with your healthcare team, you can take control rather than letting your medication quietly harm your cardiovascular health. Understanding these 5 categories isn't about fear, it's about empowerment. If your blood pressure has been creeping up despite healthy habits, it may not be your fault. But now you have the knowledge to ask the right questions. Make informed choices and protect your heart and arteries before problems escalate. As we wrap up, here is the most important message cardiologists want you to remember. High blood pressure doesn't always come from what you eat, how stressed you are, or how much you exercise. Sometimes it comes from a pill you trust and take every day without thinking twice. And that is not a failure on your part, it's a gap in awareness that affects millions of people. The 5 types of medications we talked about: common painkillers, cold and flu decongestants, certain antidepressants, steroids, and hormonal therapies are not bad drugs. Many of them are necessary, effective, and even life-saving. The danger comes when their impact on blood pressure goes unnoticed for months or years. That's when silent damage can occur to the heart, brain, kidneys, and blood vessels. The solution isn't panic. The solution is partnership. Partnership with your doctor, your pharmacist, and your own body. Read labels carefully. Tell your doctor about every pill you take, even the ones you buy without a prescription. Monitor your blood pressure at home, especially when starting or changing medications. And if your numbers don't make sense, Don't blame yourself, ask questions. Remember, controlling blood pressure is not just about lowering a number. It's about protecting your future, your heart, your memory, your independence, and your quality of life. Knowledge gives you control, and control gives you time. If this information helped you, share it with someone you care about. It could quietly protect their heart too.